Okay, good afternoon, everyone. Thank you so much for joining today's session. Today we have our Central Health online talk once again, and the topic will be on osteoarthritis. So before we begin, a quick introduction about myself. My name is Charlotte, so I will be your main facilitator for today. Okay, so today for those of you who are joining us, not for the first time already, you'll be familiar with this webinar function. Okay, so all the questions that you have along the way with regards to any of the content mentioned today, please use the Q&A function. Okay, if you type in the chat sheet, I don't think you can use the chat function, so just use the Q&A function. There will be a question and answer segment at the end of the talk once we are done, and then that's where our speakers today, they will actually reply to your questions, your queries. Okay, and then at the very end of everything, the entire session, there will be an online survey form that we will just require your help to fill in. Okay, so give us your feedback, how we can improve better next time. Today we are actually, the talk will be from 3:30 all the way to 4:30, so just 1 hour, a quick one. Please also note that this session is recorded because subsequently we'll actually upload it online on our TTSH YouTube. Okay, sure. It's 3:30. I see that many of us have joined already, so thank you so much for being punctual. I will now pass on the time to our speaker today, so Sister Wei Ju.
Hi, good afternoon. Okay, so I'm Wei Ju from TTSH Rheumatology Department, and today I'm going to share with you about osteoarthritis. It's one of the very common arthritis we see in our lives. So osteoarthritis. I think many of you are wondering what is this. Okay, so arthritis actually is a broad title. It's very common, but okay, so it's one of the most common form of arthritis we see in our friends or our patients, and it usually it's a wear and tear condition. Okay, and most of the time it affects our hand, knee, spine, and joint. Okay, so these are the area that we can see changes in our joint. Okay, so osteoarthritis on the hand actually is very common. As you see, there's a degeneration, deformities, and you see the nodes, the hardening nodes at the distal of the hand. Okay, so another very common site for osteoarthritis is our knee. Actually, because the knee is supporting our body, and it is actually undergoing a lot of stress from the body. Then you see the bone, and in between the two bones, actually there's this cartilage that is the cushion. And over the years, when we wear and tear, the cushion actually move more, and then it causing some inflammation to the joint and changes to the joint, and that's affecting the knee. Okay, so what causes osteoarthritis? There's the protective cartilage that cushions the ends of the bone in your joint, wear and tear over the time. It causes changes in the bone and deterioration of surrounding structures such as ligament, muscles, leading to symptoms like joint pain, deformities, and some patients will tell me they feel weak, they don't have the strength, and this is known as degenerative joint disease. Okay, so who are the people are prone to get osteoarthritis? The older people, the chances of getting osteoarthritis when it increase with age, and women are likely to develop osteoarthritis, although it's not clear why. Carrying extra weight to also contributes to osteoarthritis. So the bigger size patient actually has more risk to get osteoarthritis. Repeated stress on the joints, like people who actually walks a lot or carry weights also contributed to that. Genetics, so if the parent has history of osteoarthritis, so their next generation actually also have a higher risk to get osteoarthritis. Previous joint injuries, so people like sports person, sportsmen, and they got injuries due to overstrain or like accident, got fracture, also has a higher risk to get osteoarthritis. People with some metabolic disease such as diabetes also gets a higher chance to get osteoarthritis. Okay, so what are the symptoms of osteoarthritis? Of course, the patient usually experience pain, stiffness of joint, and they feel tender and warm over the joints, also swelling over the joints. With the swelling actually limit their range of movement, and some patient can tell you that, oh, actually I have clicking sound or grunting sensation when they move the joint, especially for the knee. Okay, so there's not much test that we can do, but X-ray actually just to show the reduced joints space in between the bone, can actually tell us there's osteoarthritis setting in. But sometimes the X-ray or MRI actually is just to rule out other form of arthritis, to make sure that we don't miss other more important issue. Okay, and simple lab test, sometimes the doctor may do some inflammation marker, which actually helps to diagnose if there is any infection. Joint fluid is only necessary if the joint is too swollen and the doctor has to perform knee aspiration. Then we'll send the fluid for testing to make sure it's not gout or other form of arthritis. Okay, so usually for osteoarthritis, the treatment will be general painkiller like paracetamol, very light painkiller. Sometimes the patient may not able to tolerate Panadol, like they have allergy, then of course NSAIDs is also allowed, but have to consult a GP or the doctor to get the medicine. Other than that, we actually also encourage patients to go for exercise, occupational therapy, which I will touch on this later. To the end, if the pain is very bad, very advanced osteoarthritis, then surgical and other procedure like hyaluronic acid or joint replacement, then there will be at the end of my talk. Okay, so what are complications of osteoarthritis? So when the patient in pain, they generally has poor sleep, because when they are in pain, when they turn, they feel painful, then they can't sleep well. Then the next day they will feel lousy and not able to perform well. Also affect their daily life, like ability to exercise, restrict them from performing daily tasks like going to work, going to market, and it's higher risk for older people who get falls, because when they are in pain, the muscle is weak, and they will also poor in balancing, then they will get fall very easily. With all this restriction, poor sleep, and sometimes the patient gets depression and anxiety over the pain. Okay, so I'm going to touch a little bit on the medicine, pharmacological management. Usually we can ask a patient to get over the counter with so over the counter we can get those patch for plaster for pain relief, and sometimes some patient may prefer to use the gel to rub over the knee or the ankle or the back. Okay, so other than the pain gel. We can also use, like I have mentioned, paracetamol. Of course, if patient cannot tolerate paracetamol, then NSAIDs like Coxia or Voltaren, which need to be prescribed by the doctor. Usually when you have the pain, patient will go and see the doctor, and then after the doctor has actually diagnosed, then they will give some painkiller and advice to rest. So the painkiller not necessary to be long term, but they have to be taken when they are having the pain, and then to promote rest. Okay. So at the very if the oral medication doesn't help, sometimes the swelling is bad, the doctor may suggest a joint injection to take out the fluid, and then to relieve the pain. And sometimes they also will suggest hyaluronic acid is like a gel, a lubrication gel for the joint, which needs to be done by a doctor lah, to get injected into the joint. Okay, so what other daily management we can do at home? Okay, so have to do things like weight control, which actually helps to the less heavier you are, actually can helps to minimize the stress to the joint. Is okay. And then exercise, strengthen your muscle, appropriate footwear, acupuncture and massage. Some patients may prefer to get pain relief with the acupuncture, but however the pain is still come back. And I can we also suggest some devices for old patients, like they need support when they are walking. So walking sticks, splint or brace is good. So for weight control, actually there's no particular diet that you need to follow. Just eat healthy, and to make sure your diet actually can, when you adjust your diet, you eat healthy, your weight actually gets control, and then your BMI can also achieve at a better BMI. And of course, with the diet control, exercise is also important to help. So the exercise actually also helps to bring down your body weight. So for general osteoarthritis patient, we actually promote like impact exercise like Tai Chi, yoga, or aqua therapy. Or if you don't have to swim, sometimes you just walk inside the water. The warm water actually helps to relieve the pain as well. Not to overstrain yourself, maybe twice a week, 15 to 20 minutes twice a week. Then slowly can increase to 3 times a week. Okay. If you are homebound, if the elderly is not convenient to go out for exercise, then you can do some quad exercise, strengthening exercise at home with the use of the chair, the back of the chair, or you can just do the squatting exercise at home. Okay, so with exercise, you need to have an appropriate footwear, because if we have if you need to exercise and then you are not wearing a comfortable shoe, then you may have a very bad pain at your sole or your ankle. So sport shoe actually is the good fitting shoe, and avoid heel shoe, high heel shoe. Okay, so exercise with appropriate shoe. Okay. Okay, so sometimes some elderly may need assistance. So walking sticks or quad sticks is good. And if you experience the pain and you need to go out, sometimes it would be good if you wear a supported splint, which can help to actually minimize the pain. At the end of the day, sometimes after long hours of walking or standing, osteoarthritis may give you a lot of pain at the end of the day. So what you can do actually to put a cold pack over the affected joints, and to rest, elevate your affected joint, and with the cold pack, usually the pain gets better. So how do I prevent osteoarthritis? Actually, is to avoid having joint injuries or overuse, like carrying heavy loads, repeating like squatting movement, okay, or bend down if you're carrying heavy things and bend forward is also bad for your spine. So, and another important thing is to maintain a healthy weight by eating healthy and exercise. Okay, so these are some of the useful links that you can share. And if you want to read more about this, you can actually go to this two link to find out more about osteoarthritis and like management or getting to see a specialist. Okay.
Okay, so thank you, Sister Wei Ju, for the sharing just now. Okay, so we have come to the Q&A segment. Now today, I think the content was a lot shorter, very succinct. So if let's say you have any questions, so now is the time to put in your questions. We have quite a bit of time, so do keep the questions coming in, yeah? I will just open up and see what are some of the questions that has already come in. Okay, so we have a question from one of our participants, yeah. Okay, so this first question, perhaps I'll just direct it to Sister Wei Ju. Any way to avoid hardening of the hand?
Actually, when the patient has the hardening, is because of over. Okay, can you hear me? Okay, so actually the hardening is because of overuse of the joint. So you notice if the person the hawker, you notice they had the hardening very obvious. So if you you can do light exercise but not to overuse the joint, and action like twisting actually attribute to the hardening of your joints a lot. Okay, the answer. So bunion. Okay, the next one is bunion. Bunion actually is not osteoarthritis, but it could be because of the positioning of your feet. That's why you keep on stressing on the certain angle. That's why your joint get deformed and then the bunion came out. So they are actually this bunion correction how to say this splint that you can actually get from physio or over the at the pharmacy. But if it's very bad, sometimes you may need to see a podiatry because you need a proper footwear. Okay, the next one is steroid injection. Oh no, the injection I mentioned is not steroid. Actually, it's a hyaluronic acid, which is if you consult a doctor, they will only suggest it if the osteoarthritis is bad, and it's a gel. It's not it's like a gel to the joint for cushioning. So it's not steroid. We usually don't use steroid for the knee lah. Okay, is there any particular type of walking shoes that you recommend? For example, high arch shoe, thick sole, soft sole. Okay, that's a very good question. Okay, so there are people with flat foot. So actually sport shoe is the best shoe for people, I mean for the long walking or standing person, because they have this arch support for the people who stand a lot. So if you have flat foot and your feet tend to collapse, and that's why your position is wrong, and then you get a lot of joint pain. So different exercise shoe also have different arch support. That's why you need to go and find and feel and wear, then you can feel which are the most supporting shoe for individual. Okay, yeah. Okay, the next one, supplement. Yes, I didn't touch on supplement because we don't actually believe in the supplement, because right now in the market, there's not enough evidence to prove that it does help to regrow cartilage. So but Chinese do mention say you can eat a lot of the chicken feet or cartilage food to help, but actually it doesn't really, your cartilage won't grow again, see. So only to the very advanced, then sometimes may need to do a knee replacement. Other than that, it's just to minimize walking, minimize stress to the joint. Okay, next one. Joint injection effective for limited time. Okay, so the accumulation of the fluid usually is because of inflammation. Because when just now you remember the first picture we had about the knee, when the cartilage wear off, then the bones start to get and ligament muscles start to get affected. So if the swelling is bad, then that means that there's a lot of fluids produced because there's a lot of inflammation. That is the time when the doctor will consider of drawing the fluid. If not, then elevate your knee or your joint and rest. Usually the pain, the swelling will go away. Okay, depending on whether the swelling is very bad, then the doctor will consider helping you to draw out the fluid. If not, then we try not to poke the joint because you're also inducing infection to the joint at the same time. Okay. If the underside of my right feet numb, can notice middle toe. Okay. What is the symptom? Osteoarthritis. Okay, it could be due to some degree of aging, but then I think you might want to consult a doctor because it's very hard to see, to just describe over to give advice over the description. But as long as deformity will set in, but as long as it's not giving you pain, if it's having pain, then you need to see a doctor. Okay. Next one. How effective is the okay. 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 I saw the other one. Okay. 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 So this Mr. Wong actually mentioned that he has noticed the middle toe slowly pointing to the right. Right leg, right feet. Okay. It's pointing inwards. Sticking middle. Okay, I get, okay. So he say that the middle toe actually slowly pointing to the right, sticking the middle second last toe. That means it's like the toe overlap. Am I right? Okay, so this is maybe due to aging, and it may not be osteoarthritis. It's just that aging and cause like your overuse of your toe. Your shoe might be too tight. That's why causing the overlap of the toes. So you may need to see a physio or doctor to do a correction. Okay. I'm going to attend the second one. How effective is the hyaluronic acid? Yes, used within the joint. Limit time that the injection should be repeated. Okay, so it really depends on the individual. By right, it should be 6 monthly for the patient. But the doctor usually will recommend like every 6 months. But sometimes the patient after 3 months, they experience the pain return. So they may give like not more than 3 times a year. Okay. So does OA contribute to the person getting plantar fasciitis? Okay. Actually, plantar fasciitis is more due to your positioning, the positioning of your heel, and if you are like a person who walks a lot, it may actually with a poor position, let's say like you're having flat foot, and you tend to get plantar fasciitis. That I don't think it will affect the getting OA lah. Okay, the next one. How to avoid finger joint tilt sideways? Okay, actually it's very hard to avoid because every day we have to open the lock, we turn our hand, we turn the tab. So, but now with the technology, our tab is sensor. So I will say it will be less people getting OA in a sense that if you don't use your joint a lot, like your hand a lot, then it should be less OA in your hand. Okay. Next one is frequent sitting cross-legged on the floor bed or the knee or any other joint. Okay, actually it's not okay. So they ask about frequent sitting on the floor with cross-leg. Well, it's not the action that causes the OA. As you grow older, you got OA, and it give you harder to do that position. So I will not recommend people after 40 to you can squat, but you need to support yourself when you stand up because you may lose your balance when you're trying to stand up and then you end up having a fall. Okay. Are there certain diet that can help people with joint pain or physical activity, only lifestyle management stuff? Okay, so diet that help the joint pain. Actually, well-balanced diet with things like improve your calcium intake, which helps the bone. Green vegetables also actually improve is healthy, and then it can actually support your daily intake of vitamin K as well. So I would say just eat everything, meat, fish, healthy balanced diet, and low salt actually already helps to prevent other disease as well. Okay, lifestyle. We're sleeping in aircon. No, okay, sorry. We're sleeping in aircon room worsen osteoarthritis. I would say no. Yeah, because yeah. So is lower thumb joint bone coming out of the joint osteoarthritis possible? But we need to see the picture of the hand. Okay. Okay, no more.
Okay, so far that is all the questions that we have received. Now, if you have any more questions, please feel free to type in. So actually now we still have almost half an hour left, okay? There's a lot of time for us to do the Q&A, and thank you so much for all the questions that have already come in. So just now somebody actually requested to flash the exercise slides again. So here they are. Okay, don't worry if let's say you would like to refer to the slides again, because it will be sent to you after today's talk, okay, via the email address that you have given to us when you registered. Okay, so for now, let's say if you still have questions, do just type them in, and then our speakers will actually answer along the way. For those of you who are okay, you don't really have any questions, just help us do our feedback question in the meantime. And then of course, if you think of any other questions, do feel free to type them into the Q&A function. Okay, so here is the QR code for our feedback form. My colleague has also dropped the clickable link into the chat function, so you should be able to click on it. Okay, so today our talk is on osteoarthritis. If let's say there are additional materials that you would like to see, maybe like brochures, posters, pamphlets, this can actually be found on our TTSH Health Library. Okay, so the Health Library, you can also see that there is a QR code over there with the URL. So all these are online materials, they are free of charge. Anytime you would like to refer back to them, you can go to this link. Okay, and then other than that, if let's say you want to join us for all our subsequent sessions, you want to keep in touch with us on all the latest events, health talks, opportunities, etc., we do have social media pages, both Facebook as well as Instagram. So please do follow us if you'd like to get in touch or keep in touch. Okay, so I will just leave it on this slide for a while. I do see questions still coming in. Okay, let's get back to the Q&A segment, yeah?
Okay, so besides the knee and the hand, which other parts of the body may also like to have osteoarthritis? Actually, the more common places is hand and the knee, but sometimes I do have patient with our shoulder and the neck. Okay. Okay. If we do not twist using our hand, then what should we do to dry the clothes? Okay. Okay, so we have washing machine nowadays, right? Or sometimes when you our kitchen, you use kitchen towel, wipe and throw. Okay. If not, you just strip dry your clothes, and then after a while the clothes will be dry. I mean, stop dripping. Okay. Then the next one, I have been having hip joint pain on my left hip during X-ray confirm osteoarthritis, given Lyrica NRX for the past 3 years. I tried doing exercise, physio give me, but still pain is there. Is there? And yeah, okay. So since this patient actually already have physio and pain relief, if it does not improve, then you may want to see a surgeon to see whether they can do surgery to improve the, because I do not know what is the extent. If there is still joint space, the surgeon might not want to do a surgery, but because it's quite a deep bone, hip bone, so usually the advice could be surgery, which can, depending on how young you are. Okay, if young patients, sometimes they may suggest a surgery, and so to improve the pain. Okay, is walking bad for OA? Generally walking, we need to walk. So depending on how extensive is your walk, if it's just a brisk walking for people like elderly, then it's fine. Our health promotion board say we need 10,000 steps per day, right? Then we should use that for guide. Okay, then how to prevent OA from getting worse on the hip and spine? Okay, don't carry heavy stuff. Do the stretching exercise or the quad exercise. And then of course, when you know that the pain is coming, you really need to respect the pain and rest and take some Panadol pain relief to rest. And for arthritis, usually sometimes the patient may experience good days and bad days. So during your good days, don't overstress yourself with a lot of activities. Make sure you rest in between so that you can manage your other lifestyle as well. Okay, if go to supermarket, carry things, is better to carry with hand or wrist. It's better to carry with shoulder. Get a bag with shoulder. The best is to use a market trolley, will be better. Pushing will be better. That's the best option for all the joint. Okay. There is still space. Okay, Mr. Isaac just now, yes. So there is still space. I wonder if have you seen a specialist? If your specialist actually can give you a suggestion like do they think that it's time to do a joint replacement? If they think that there is still space, then maybe you just need to do more physio, rest, and make sure you take the pain relief. What is the best treatment for finger OA? Actually, finger, there's no surgery. And even if surgery correction, it may not be able to function. So usually finger is just pain relief. Soak in the cold water to release the pain, and then not to overuse your joints with like carrying things with the finger a lot. Okay. So the next, in one of the slide, there is a green and black knee band. What is purpose? The brand. Actually, you can actually search in online. Can buy from the pharmacy. It's just a sample. It may not be the best brand, because there is many brand with braces or knee guard or ankle guard in the market. I have tried in not every gut or the gut actually give you support. You really have to try it at the pharmacy, then you can feel whether it's supporting, then you decide whether to buy it or not. Okay, how to prevent OA for cervical spine? Okay, some people like to do this, like, right? Don't do that to the neck. It's very bad. Okay, elbow is usually when like we carry heavy groceries with your arm. So elbow usually some people like to do this stretching of the arm also. Actually, it's bad for the joint. Hip. I think it's carrying heavy thing like school bags for your hip. Toes and ankle. Toes are actually very rare got OA, but ankle is because your whole body weight actually is onto your knee and your ankle. So try not to carry heavy stuff, and then try to push lah. Okay, can you please show the movement more ideal, those with metal stripe or those knee guard metal stripe? Okay, sorry, yeah. Okay. So metal stripe usually are those who has a tendon tear. So if it's just for muscle, I think you do not require with the metal stripe type of guard. But if you think that the metal stripe is better support, you can always try that, use that. Because if you strap your knee for too long, you also get sweating and you feel very uncomfortable. So you have to really try it and see which one is the best for your depending on what you are doing. You see, if you are like going for trekking, going for exercise, you feel with the metal strap is metal support is better, then of course I would say use that for exercise, and then you can use the normal one without metal support for your usual days. Can you please show me the movement to avoid to prevent OAs? No, what I mean is some people like to turn their neck, and make that sound. So try not to do that. Okay, we'll be having this talk in Mandarin. Okay, can consider. Okay, what does the knee what does the knee guard serve besides support? Okay, yes, when they support, when they do the support, your muscle also tighten, and then you don't get to fall easily. Okay, what is mean by heavy? Okay, anything more than 5 kg actually is considered heavy for our body, or for people with osteoarthritis. So example, 5 kg is like a bag of rice. So if you're like going to market, or a laptop, actually also more than 5 kg. So if you can, use your shoulder, so you carry with shoulder bag, not use your hand to carry. The ankle has a clicking sound. Okay, so is this the sign of impending OA? It's possible, but ankle, is it very often, this clicking sound? If it's just occasionally, then you have to start supporting, like wear an ankle guard, make sure you don't injure the joint. Okay, to prevent osteoarthritis now. Okay.
Okay, so can we believe it? We have answered almost 40 questions so far. Okay, so if you have any more questions, do keep them coming in. Still have time. Yes. Okay, so I see that there are 2 more questions coming in. Yeah.
Okay. Okay, so yes, this ankle has been sprained before. Okay, so as my slide has mentioned, if you have history of injury, then you have higher risk to get osteoarthritis later on. So that's why I have to has to start protecting your joint. Okay, so the next one, I exercise to use my joints. I like bend down my knee and hear clicking sound. What should I do? Then you should do more gentle exercise, not to stress your knee too much. Okay. Okay.
Okay, we will give it a while more. Perhaps so now it's about 4:09, 4:10. We will give it a while until 4:15. So maybe we will take the. Okay, so every time I say that we are running out of questions, then new questions come in. Okay.
Okay, I think the last three. Okay, so mention haversack bag is suitable for backache, OA, knee arthritis, neck expert. Well, haversack bag it can be used, but as long as not more than 5 kg, not too the bag not too heavy for your back. Okay. When choosing shoe, I just try to see whether I'm comfortable. Is that sufficient? Yes, actually, when you try to walk around the shop to make sure that you don't feel painful. Because sometimes after a while, if you walk too long with that shoe, then you realize, oh, actually the shoe is not supporting enough. So that's why when you go and find shoes, like in the sports shop, when you wear in the shoe, when you're trying the shoe, you need to walk 2 rounds to make sure you feel comfortable. Then you can actually purchase the shoe. Okay, if we have OA, how can we exercise well daily? Okay, so that is very good question. So for arthritis patient, there is good days, there is bad days, right? So when you are having arthritis OA, when you have the pain, then you really have to rest. Because if you don't rest and you went straight with the exercise, you may come back with very bad pain. And then you end up 2-3 days cannot exercise. Am I right? So the main thing is respect your pain. When you have pain, you rest. And you only exercise when you have your pain has gone or you have minimal pain. Okay. Does OA come naturally with all old age as part of aging? Yes, I do agree with that. It's just part of aging and we just need to know how to manage it and not to let it affect you by making you not able to exercise or not able to do things that you want. So that's why you really need to rest the pain when the pain comes and respect the pain so that you rest, take your painkiller or put your pain gel to relieve the pain, then rest more 1 more day and you feel you are better, then you can start to do your exercise again. Maybe start at a low impact one like the squat exercise at home. And then if the pain not getting worse, then you can proceed to your usual outdoor exercise. Okay, so for older folks like 60s, is there anything they can do to defer OA? Well, I think 60s already, you actually want to enjoy life, right? So if you want to like do anything to defer OA, okay, so actually there's nothing much we can do except eat healthy, be healthy, exercise, strengthen muscle daily. Okay, then carrying laptop on shoulder bag or backpack is more helpful. The laptop, okay, nowadays we have a lighter version laptop. If your laptop is heavy, then I suggest you might want to get a trolley bag. But if it's not giving you a very bad pain, you can actually use if your laptop, you can change your laptop to a lighter type. Okay, squatting exercise causes hip. Then how to my knee? Then how can I strengthen my muscle around the knee? So actually just now I have this squatting exercise with the holding onto the back of the chair. Actually that is good to strengthen the thigh muscle. Squatting exercise causes, oh, this is the same one. Okay, so sorry. May I know who is addressing this talk? Very well information and patience. Thank you. Okay, is it better to split carrying load? Yes, okay. Taking 2 shoulder bag instead of 1 shoulder for grocery shopping. Yes, definitely. If you lighten, but of course, if all the weight is onto your body, even though you carry 2 shoulders, it will also still add up onto your body. So the best thing is to use a market trolley. Okay. Yeah. Thank you so much. Okay. So walk. Okay. Walking too long. Sitting down, facing PC. Does this affect? Walking too long. Okay, walking too long, sitting down facing the PC, does this affect or worsen osteoarthritis? Well, like I say, you need to do some exercise to strengthen your muscle. So if you sit too long, you may get stiffness from the osteoarthritis. So try to make sure you do exercise like 2 to 3 times a week with 20 or 15 or 20 minutes. Or to go a few journey to get the things. Okay. So nowadays order online is another better option. The heavy things you can order online to deliver to your house, then you don't have to walk so many times. Would it be a better option? Okay, so to minimize knee OA is to strengthen the thigh muscle. Yes. Okay. Yes, agree by online. Okay, online business very good. Going good. Okay.
Okay, quick time check. Now it's 4:15. Okay, we will give about 10 minutes more to do the Q&A, so until 4:25. Then after that, we will go back to the feedback, that slide for everybody to just scan your QR code one last time. And then if anyone has any burning questions left for the last 5 minutes, feel free to stay over. Otherwise, you're free to go on to your next activity. You're free to leave the webinar. Okay, so we'll give it until 4:25, so 9 more minutes. If anyone like me to flash back any of the previous slides, so I know there's been a few requests to go back to the exercise, so I think it's this one. Okay, if you have any other requests that you need me to flash the slides again, to let us know, yeah? Okay, and thank you so much for all the very kind feedback. So today's our speaker is Sister Choi Wei Ju. So I think a lot of you have said that very well informed, answer all your questions. Yeah. So okay, a round of applause to our Sister Choi. Okay.
Okay, thank you. Okay. This was a slide of the show area prone to get OA. Yes. So,
Okay, so don't worry about the slides. We will actually send it to you via email. Okay.
the slides. Okay. Okay, there are 4 types of exercise, or we can do, or there are others. Okay, I can answer that first. Okay, so there are 4 types of exercise that I have shown in the slide. Actually, these are more easy to do at home. You don't require a lot weights or anything. You just need a chair, or in fact a wall. But of course, with the chair, you can have better support. Sometimes if the patient require a physiotherapy, the expertise from physio will actually give more suggestion. If you need, then we may have to see a physiotherapy, because this is something easy to achieve or to do at home. Okay. With OA, can one still use massage chair, etc.? Yes, with OA, you still can use massage chair. Yeah, as long as it doesn't give you more pain after the massage. Okay, so has ganglion cyst has anything to do on the wrist, right? The ganglion cyst. Well, you also actually press on your nerves sometimes and get pain on the joint. So you may consider seeing a specialist for that. Okay, can please send the web link to do survey.
Hey,
Excellent. Thank
all right.
you.
All right, so
Yeah.
thank you everyone for your feedback. Okay, so if there are no more questions, we will just flash the last slide again on feedback. Okay, so okay, every time I say that, then there's a new question. Okay, thank you guys so much. Okay, for the support. So I'll just flash this one, and then Sister Weju will just take a few more questions as they come in. Otherwise, please feel free if you need to go on to your next activity or if you need to leave the webinar. So we will close the room at 4:30. Okay, we'll just make one last announcement before we close.
Okay, there's a question. Do you apply cold or heat for the pain? Actually, when you have pain, we usually ask the patient to use cold pad. If you get stiffness, then you use hot in the morning, especially. So pain is cold, and stiff you use hot. Okay.
Seems
Okay, so mean by stiff, how do you mean by stiffness, and how is it feel like? Okay, so the description usually is they feel like very difficult to move, like trying to get up from the chair or the bed. That usually is the stiffness, like trying to open up, then they feel very stiff. Then you may actually use a hot pad or hot hair dryer to blow the joint. Then in the afternoon, or after you walk a lot, or after you exercise, you feel your joint is the pain is coming, you can actually use the cold pad. Okay, pain is cold, stiff is how? Oh no, okay. How do I? Okay, so pain is cold, use cold, and stiffness is use hot pad. Yes. Have missed earlier part of the webinar. Is there any way to revisit the talk? Yes. I think this.
yeah, so our talk will actually be uploaded on YouTube. And then, of course, if you have the email with us, we will send you the link afterwards also.
Okay, so hot can use hair dryer. Yes, actually, this is how I teach my patient. Because if they have difficulty to get off the bed to get a hot pack, so you can actually put your hair dryer and just on the switch and then blow. It's easier. Yeah, for hot therapy, yes. Usually the hot is more in the morning when they're trying to get out of the bed. So sometimes the patient may feel very stiff, then hot shower might be useful. But then when you're having pain and swelling, then you use cold pad. Okay. Can soak feet in warm water help to relieve the long height? Help. Thanks for hosting. Okay. So yes, soaking the feet in warm water, depending on how you feel, because if you're like walking for too long, you had a strenuous basketball exercise, and then your feet come back very tired, then you can use cold water actually instead of warm water, because warm will promote more heat in the joint and then end up more joint pain. How long for cold therapy and how long for hot? Okay, hot usually just 5 minutes if you use the hair dryer or the hot pack. If cold, usually we tell patient about cold, like ice pack or ice towel. You put a towel in the freezer, then you take out and wrap around the joint for maybe 5-10 minutes, and then rest for 10 minutes, and then put again the cold pack another 5-10 minutes. Cold pack for pain and inflammation. How do we know our joint are inflamed? Yes. So when you're having inflammation, usually it's swollen, and then if you feel the joint, sometimes it could be warm and hot, then you use cold pack. But isn't cold make the worst joint? OA. Not really. Actually, when you're having the osteoarthritis, the pain is painful and hot. So you may want to use the cold to cool down the cells and to cool down the inflammation. When walk for several hours, to use cold or hot? Yes, use cold. Elevate your feet. For warm water for tiring muscle after a long walk, yes, you can use warm water. But after a tiring muscle for a long walk, you can actually use warm water, but cold water actually helps to reduce the swelling as well. Anti-inflammatory cream helps over which area? If it's just on the fingers, yes, you can actually apply and then rest the joint. But if it's over like in a hip, it's a bit hard to apply. Ankle, yes, you can apply on the ankle and rest the joint.
Okay, thank you everybody. We ended at a very good time. Okay, so 4:25. Thank you so much for joining us today. If you have any additional questions, you can also feel free to put them at the end of the feedback form when you're submitting it online. Okay, and then as we go through the feedback, then you'll be able to see and you'll be able to direct these questions accordingly as well. Otherwise, thank you so much for joining us today. See you. Hope we will see you again next time when we have our next Central Health online talk. Okay, thank you so much. Bye-bye.